Where again?
What's your name?
Dana.
What grade are you in?
Fourth.
Fourth grade? Okay. So what are some things that make you happy?
Oh, I like going to swimming, swimming, gymnastics, and and going swimming with my cousin's house and play volleyball. And that's it. Oh, and I did play the water slide.
The water slide? Yeah, that's fun. And what makes you mad?
Someone takes my stuff.
Someone takes your stuff?
That makes me mad too.
What makes you laugh?
That jokes.
Jokes make you laugh?
Funny.
Funny jokes? What makes you sad?
Bad.
Homework.
Wait, no homework.
No homework?
No. We take it from us at school. No, with a fake name. That's DJ.
When the DJ picked you at school,
Yep.
that made you mad?
Not resin.
Not resin?
I'm a with a pick me because with a pick me.
Resin pick me.
Yeah, it's a fair though.
Everybody gets different partners.
Yeah. And I can have with a corner one time.
Maybe next time.
Yeah, next time.
So how many best friends do you have?
Best friends? Maddie, Rosa, Ella, Maddie, yeah, all that stuff. Oh, and Lizzie, yeah, and Phoebe.
And Phoebe?
Phoebe and Fiona.
Okay, so what is the hardest thing that you ever had to do?
What?
The hardest thing that you've ever had to do?
230 million.
230 million?
Yep.
What's the hardest thing you have to do? Do you have to do anything that's really hard?
No.
Everything's easy.
Yeah, easy.
All right. And what do you love most in the whole wide world?
I don't know. Gymnastics, daily.
What do you love the most?
What?
What do you love most?
Love?
Love.
Gymnastics.
Gymnastics?
Yeah. Yep.
It's not a person. Who do you love the most?
Love?
Who do you love? Who's the person you love the most?
I go to high school.
No, not like that.
Next week, yeah. What?
Who's your love you the most, or your sister, or your daddy? Who do you love the most?
I don't know. I'm thinking at school.
You love someone at school more than us?
Yeah.
I understand.
Someone loves eat any. What?
I know what you're thinking, but that's not allowed.
What?
You're thinking about Evan.
I'm going to high school on after I'm going 4th grade. Yeah.
And then in high school, she can have a boyfriend.
Yes, in high school.
2 boyfriends.
Oh, 2? Did an excellent job.
Thank you.
Do you want to say anything else?
No, thank you.
Oh. When you were found out that she was diagnosed with Down syndrome, how did you feel about that?
I was pregnant when I found out. So we had I can't even remember the name of the blood test, just the blood test. And it came back not positive, not negative, but enough to be, concerning. So we were, it came back kind of questionable. So I went in for an ultrasound. We got to the hospital and they did this high-powered machine ultrasound. And that came back also questionable. Not really positive and not really negative. Like her kidneys were kind of dilated, the back of her neck wasn't too big, and the femur length was the right size, but it was just all kind of random things. And again, at the end, the doctor said, not really positive, not negative. He says, if it's my child, I'm saying this is it. The child does not have Down syndrome, and I would just go into pregnancy. And I said, I'll take the amnio because I need to be prepared. Because I really didn't know anything about Down syndrome except what it looked like. I could pick it out of a lineup, but I didn't know what to expect. So we went in for the amnio, and then the doctor called and said, it is positive, it's a girl, she has Down syndrome. So, okay. So it was a little shocking, I wasn't expecting that. And I wasn't thrilled about the diagnosis at all, but I thought, okay, this is what it is. This is what it is. So the medical community, ironically, immediately pushed me to have an abortion. They immediately were saying, we can sign you up for a procedure. And I was, procedure for what? You can take away Down syndrome? And they're like, no, if you want to, try again at another time. And I was like, no, I got it. Yeah, no, thank you. We're good. So I heard that from the person who gave the news. I heard it from the person who, we went in for another exam afterwards, because then they had to check her heart, which her heart was fine. And they said again, it's not too late if you want to terminate the pregnancy. And so that was, I wish that wouldn't have been what they said, but that's what they said. So we went to genetic counseling. They, for the third time, offered us an abortion. So we decided to skip the medical community at that time, and I started going to support groups, Down syndrome support groups, and that's where I met other families and other children, and got to support. What is this about? Similar to what you're doing. Tell me about Down syndrome. It's so bad, right? It's not so bad. I was like, okay, I can do this. So we continued her pregnancy. We had her, and she's been great.
Was there any kind of problems when she was born that you
Reached her 3 weeks early, 9 pounds 3 weeks early. So 37 weeks, her lungs were not quite finished. They thought that they would be, but I guess in typical developing children, they would have been. But for her, it was more difficult to breathe just because of her low muscle tone. So she was in the NICU for 21 days. They did a whole battery of tests to see what else was her problem, and really, other than having Down syndrome and not being able to sat oxygen, she was fine. Yeah, so that was lucky. So 21 days of oxygen in the NICU. And I wanted to take her after 7. After all the tests came back and she was healthy, I was like, great, we'll give her oxygen at home. And they said that at this particular hospital, they don't do that you can't get the machine, you can't get the pulse oximeters, so she'll stay until she can breathe. And so another week went by, she still couldn't breathe on her own. And so I said, we're done with this. If she had diabetes, I would give her insulin. She needs oxygen, I will give it to her. Because it's my goal to keep her alive as well. And NICU is not a great environment for a thriving baby. It's very quiet, it's meant for tiny babies who need to sleep. She was not a tiny baby who needed to sleep. So I spent the 3rd week convincing my doctor to let me take her home. I found where we could get in-home oxygen, we could get a pulse oximeter. I got reports from other hospitals, similar size, and similar communities, who send babies home on oxygen. Delivered the reports, and said, I want to do this. So they let my husband and I spend the night with her, and to see if we could handle it, and she was still alive in the morning. And so we got to take her home. So 21 days at NICU, we took her home with oxygen. She was on oxygen, and we took her everywhere. So we're going to the park, bring your oxygen. And we're going to the pool, bring your oxygen. And she just came with us. I didn't know she could have been like that forever. I didn't know. But then a week later, she seemed to be able to hold her own with oxygen, and hasn't needed it since. That's the good news. 2 months, ironically, 2 months after that, a woman called me on the phone and said, you don't know me, but my son was born with Down syndrome, same hospital, and the nurses said I should call and thank you because we're home with oxygen.
Oh.
Isn't that nice? Yeah, so now he's 3 months younger than Dana. So and has the same diagnosis of Down syndrome and unable to breathe.
Yeah.
Yeah, it's a good story.
Dana, she looks like a normal child. I mean, you can see a little.
You can see it in her
bit,
face.
yeah, a little bit, but other than that, I mean, she's just like a normal,
like
a little 9-year-old. Yeah.
Yeah, not like others, very,
Yeah,
She's
very distinct. She's not.
really lucky.
Yeah.
I mean, I really feel lucky with her. My nephew is a different story. He's much more involved. He has much more challenges. He had open heart surgery at 2 months old. He's very delayed, very affected by his Down syndrome. She seems to be doing pretty well. She's
No other
fully-
problems. She's had no other problems. Just
No, she reads and writes and does math and multiplies, and she can communicate, obviously, right? She can take care of herself in a situation. I mean, I don't leave her alone, but how many 9-year-olds are left alone anyway?
yeah.
You know, just because I don't leave my other children alone either. And she seems to be doing pretty well.
Is she in a normal class?
She is.
Yeah, because she goes, yeah.
Yeah, she's just in a regular class. So she finished kindergarten right in the middle of the class. It's with no accommodations and nothing special. But she left right in the middle of the class. And then she finished first grade in the bottom 10. She finished second grade, second to the bottom. And third grade, she finished at the bottom except for reading. So she doesn't quite get things. I think her comprehension isn't quite as good as the other children's, but she grew it.
Does
She
she-
has just regular problems.
Just regular problems. That's fine. Yeah.
Regular problems, but nothing just like this. I wanted this boy to pick me, but that boy picked
Yeah.
me, and he's cute or whatever.
Exactly.
She loves boys, and she already knows who she wants her boyfriend to be. She already knows. She's got it. So those are her. But not really. She's really actually very popular. Birthday parties, more sleepovers. Everybody knows her in the school. She's super, happy to meet you. Right? She's like, go talk to them. Okay. But
Does it things get stressful? Like you worry something's gonna, I mean, we all worry about our children. But do you feel like you worry more about her because she has like a general, problem? Like, do they say, watch for this because this could happen? Do you think that you watch her more?
I don't.
Not the same as all your kids.
But I think we're in a special circumstance. We really are.
Yeah.
Because I think things are more stressful for them as far as just danger. But she hasn't shown any of that. I worry about in the future when people take advantage of her, but I don't know. We'll have to see how that goes.
You predict that she can be independent?
I predict that she'll have some independence. She doesn't need help doing anything really. Like she can take care of all of her personal needs and get to school on time and I drive her, but she gets herself ready. She can get to her class. She knows where to go. She knows what to do. So we don't have those issues. I mean, we went through a stage when she was 3 where she was a runner. She would run away, and it was awful. And I took parenting classes. I had a behavioralist come in. I was like, this is bad. And she had no awareness of strangers or danger and it was blatant and bad. And she opened the door one time naked and walked outside to talk to 2 Jehovah's Witness boys. They were like, little girl naked. They were just as freaked out as she was. She was like, what? But we got rid of that.
So she is aware that
She's aware of privacy.
Yes.
And yes, and she doesn't answer the door. And if she has a question, if she's home and I'm at the neighbor's house, she can call me on the phone. She can send a text. She can walk over there.
Oh.
Yeah. But she's like, I'm home. I'm good. I'll just call you if I need you. And I get a call if she needs me or a text. Yeah. I have grapes. Sure.
What are some of your coping strategies? I mean, she's very, very, functional, so I don't know if you really even need any coping strategies, because like I said, you can barely tell that.
She's pretty stubborn.
Yeah.
Well, I would say stubborn, spirited. Lots of kids are. I hate that everybody with Down syndrome is stubborn. Because they're not all of them. And they all like to hug. Everybody likes to hug. Coping for stress would be, the things that stress me out of it are, obviously I don't have a crystal ball. I don't know where things are going, but neither do any of our children. But the stress of, it's so frustrating that she has to try so hard. I feel bad for her that she works double hard, triple hard to get the same or less of a result. And that's stressful.
Yeah, because even a child that doesn't have any kind of, the problems have a hard time, getting things. So I can imagine
Just that. It's
Taking
very,
her
it's very
longer.
stressful because I don't let her off the hook just because it's hard for her. We just have to work harder. And so that, I mean, she does more homework than everybody else. She reads more than everybody else. She has to be explained. She has to repeat things back more than everybody else. And she gets less of a result. Yeah, so it's hard,
Yeah.
but it's hard. That's just it. She rises to the occasion. She does very well. But it does get stressful because I know we have goals. We had a goal to have all of her multiplication by the end of the summer, and she had tonsil and adenoid surgery that was way worse than I thought it was going to be. It's like the worst thing I've ever been through. She went through it, but it was bad for me. It was awful, and that set us back. And it was like a week left, and we still needed 7s and 9s. And she got them.
She got
She
them.
got them.
Good for her.
Is she the youngest?
She's the youngest of 3.
She's the only one girl?
No, older boy, middle girl, little girl.
Okay.
Yeah, we have a great relationship. The older girl is a competitive gymnast. She's at the gym 1,000,000 hours a week, like 20 plus hours a week. And she has a lot of friends in that little group of athletes, and they are all great with Dan. They do things with her all the time, and yeah, they're really good with her.
That's good. The most extraordinary trait in your daughter.
She is extraordinary, huh? It is her ability to make friends everywhere she goes.
I can see. She's funny. Yeah.
Just we'll be at the beach and all the kids will be playing right here in our little group that we brought, and she'll be running back, I have a new friend! And they'll be playing and holding hands, and yeah, just her ability to make friends. And
Do they need attention a lot? A lot of attention?
does she?
Yeah.
No.
No.
She doesn't. Typically children with Down syndrome are very happy left alone. And that's just, and I hate those stereotypes.
So she's not like that.
But no, I mean, babies with Down syndrome are typically the easiest people in the world because you can set them down and walk away and they'll just sit there because they need that extra stimulation. They need it. And if you don't give it to them, they don't seek it like other children do. And I'm stereotyping and I hate it, but not everybody's like that. But I never did that with her. We were always on her. But if I need her to go watch a TV show, great. Go play on your iPad, fine. She's happy to go play by herself or watch TV or whatever, or come to us and play. Yeah.
I do have one more question. If someone come to you that was pregnant and their child was, they were told that their child may be have Down syndrome, well, what would you tell them because of your situation?
I would probably stay away at that moment from, oh, you're so blessed, congratulations. I would stay away from that. I would go more to that, it must be difficult. It must be a difficult diagnosis and a difficult idea. But I'm telling you, it's not going to be fast. Because people who want to parent, they typically want to parent. And the feelings that I have for her are not different. So we have successes and we have failures, and that's what being a parent is. So if you're looking to parent, they're great children. They're great human beings to parent. Yeah, so I would say, I know it's not what you expected, but it's going to be better than you think.
That's awesome. You're awesome.
It's the truth, it really is. They tell the moms that come to me and they're like, how do you do it? What is it going to be like? And I said, when this girl does a double backflip and she sticks it, I'm ecstatic and I'm screaming and woo. When this one does a cartwheel or a whatever and she's cheerleading, I'm ecstatic. Sorry.
Etiology and pathophysiology. Down syndrome is the most common chromosomal abnormality. It affects 1 in 600 to 800 births. The risk of having a child with Down syndrome increases with age, especially as a woman passes 35 years of age. The majority of cases of Down syndrome are attributable to an extra chromosome on the 21st pair, also known as trisomy 21. Clinical manifestations. Children with Down syndrome have a characteristic facial appearance. It includes a small rounded skull with a flat occiput, upward slanting eyes with epicanthial folds, flat nose, protruding tongue, short, thick neck, hypotonic extremities, mottled skin, low set ears, and a simian crease on the palmar side of the hand. All children with Down syndrome have some degree of intellectual impairment ranging from low to severe. Typically, they display strengths in visual processing over auditory. They also have weaknesses in grammar and language and delays in motor development. Children with Down syndrome are often prone to upper respiratory tract infections and frequent otitis media, and many of them end up with congenital heart defects. Other associated problems include increased incidence of leukemia, dysfunction of the immune system, and thyroid dysfunction, typically hypothyroidism. Nursing interventions. Caring for a child with Down syndrome focuses on promoting optimal development and providing the parents with support, education, and referrals. Encourage parents to enroll their child in an early intervention program that will facilitate the child's self-care abilities and assist in the parent's future needs. When teaching, break up each task into small specific steps because the child will not always be able to understand the task as a whole. Encourage parents to focus on the normal needs of all children, that's including love, social interaction, and play. It is essential to teach the parents normal developmental milestones, normal speech development, sexual development, stimulation techniques, and the role of positive self-esteem in motivating children to accomplish goals within their limitations. Before a child engages in sports that involve putting stress on the neck, evaluate the child for atlantoaxial instability. Affected children are at risk for spinal cord compression. Symptoms include persistent neck pain, loss of established motor skills, and bladder and bowel control. Also, changes in sensation. Nursing diagnosis. Failure to thrive related to chromosomal abnormality manifested by a child not meeting developmental milestones. Activity intolerance related to spinal cord compression secondary to stress on head and neck manifested by persistent neck pain.